Hi, this is day 9, I think. I'm finally discharged and I'm home, and it's been a really tiring day. My friend came to visit me in the morning, and um, after that, there's a girl who has similar surgery to mine, and her parents are dead worried because she's just 16. And they came to my room and spent like a whole 2 hours talking to my mom. Um, between about 11 to like 1 p.m., I had too many people talking around me, and normally noise isn't a problem for me. I mean, I'm I would think I'm quite a bubbly person, and I like talking to people, but when there's too much noise and there's too much in your mind and you're trying to get this charge and packing and everything, it just got so overwhelming that I got, for the first time ever since surgery, a headache. I didn't get a headache from post-op, from the drugs and everything. I mean, I've got aching and stuff and pain. I didn't actually get a headache. It's my first time getting a headache since surgery. And I went out to a restaurant to eat. It's really not wise to go to a Chinese restaurant when you're, you know, like me right now. And, all I could eat was tofu, which is a bit sad. Well, anyway, besides that, I'm home, and once I'm home, it's fine because, my family can just help me lift stuff, and, I'm now not living in my own room. I'm living in a room on the second floor because my room is on the third floor and it's a bit high for me at the moment because I get tired very easily. This is my day 9 look, by the way. I think my nose went down like significantly, so I'm beginning to be less and less worried about it. I think, yeah, I'm gonna just take the doctor's advice and know that, yeah, if I compare my pre and post noses, obviously, yeah, there's some tipping, you know, but as long as, the nose is still rather parallel to the ground, I'm not like a pig, then it's fine. Um, it doesn't seem like I'm a pig, I hope. But yeah, it's still a bit too early to tell, of course. My friend who came today actually realized that my nose had a bit of tipping, but that is after like intense scrutiny and me asking her like, "Do you see a difference? Do you see a difference?" Well, besides that, I'm just so happy to be home. But a headache is just getting really, really bad. Oh, in terms of just some recovery tips, I went to see my surgeon before coming home, obviously, and I was like, "Could you give some mouthwash? Because I think I'm running out." And he was like, "Don't use mouthwash. Use salt water." I'm like, "You serious? If it hurts and the salt goes into my wounds, I will kill you." And he was like, "No, it won't. Why don't people trust doctors anymore?" And I'm like, "Okay, I'll trust you." But he said, just in case, he gave me a bottle of mouthwash, just in case. Okay, and the reason for avoiding mouthwash is because, well, firstly, chemicals are never good, and secondly, what's that? Oh, staining of the teeth is something you want to avoid. Uh, what else? Um, Let me think. Food wise, I'm able to try solid foods, but I realize that, like I said, my bite isn't actually perfect. Like, I can't actually close my jaw, like, close. Like, have all the teeth meet each other up and down, upper jaw and lower jaw. The bite is actually quite lopsided. I can bite my jaw close on my left side of my jaw. The right side had a little gap, and I realized that the front and the front few teeth, they're getting a bit further and further from the back teeth, like as if it's just going like that more and more. Cause uh, I can very easily bite my tongue now instead of it being exactly closed like that and nothing goes through. I think I don't know if you know what I'm saying. It's sort of like this is your upper jaw, this is your lower jaw. I feel that there's a bit of a space there. It used to be like that. It used to feel like that, and now it's like that. You know, but I think all in all, the main thing is that the swelling has went down, and I'm not gonna complain too much about the bite because the surgeons already said that um I need to do orthodontics for the teeth to adjust because the molds are just never gonna be perfect. Then they're just human predictions of how your teeth will bite, and ideally they should be perfect, but they rarely are. So that is why most people still need to get braces done after, they can't immediately take off their braces after surgery. So yeah, but this is, me today. Everything's okay, and well, hopefully if this goes down a bit more and I'll just be able to stop complaining. Just like that. Yeah, like that. And yeah, now it's sort of like that. I'm hoping it'll go down a bit like that. And of course, there's still swelling here. And to me, the more swelling now, the better because it means that my nose will just keep getting smaller. So I know it's a warp mentality, but that's the mentality I'm having. Besides that, yeah, I'm feeling fine. Headache's beginning to be a bit better, I think, after sleeping for a bit. And yeah, my rent is over. I'll be trying to mint up my own food. I think I'll be trying some new stuff. Right now, what's next to me are raisins. Because I ate them before I left for surgery. Because I had exams right before surgery. And I ate loads of these. And I still have one packet. And I'm really tempted to still eat them. Because they're actually really nice. So yeah, okay, I'm gonna go. Enough ranting from me. The main thing is just swelling's quite down. The nose became smaller. The body's unstable, but I'm not complaining. And for the first time ever, I've got a headache. But I don't think that's actually because of anything besides having 2 rushed a day. Sorry, the video got cut off. I just have a side note. I decided to just rant a bit about how I think people around your surgery patients should phrase their questions. Cause basically I've been having nightmares, like seriously, nightmares about friends calling me a pig and how my surgeon actually added a nose bridge for me, but it was moving about. I mean, I had loads of nightmares, it's just really, really terrible. But anyway, because of that, I've been treating a lot of questions that my friends ask me in a sort of ultra sensitive way. Like, for example, I have friends who have asked me for photos, and I would tell them like, yeah, sure, but don't circulate it. And my friend actually recently asked me, so why? I mean, you're already making YouTube videos anyway, so what's the big deal about people asking for photos? And I actually realized that, yeah, it might sound really weird for me to be saying that, but, this is the explanation for it. I am okay with, people seeing my videos to educate themselves about jaw surgery and stuff like that, and just to see how it is. But for some reason, it is kind of upsetting if people are just asking you how you are to get your photo, just to be able to watch the drama so to say. You know, it's sort of like they're not asking how you are to care about you. They're not asking for your photo to just, you know, they're just genuinely asking you not to care about you, but to get the photo to satisfy their curiosity about how someone would look like pre and post op. And it's not an evil thing. It's just that to me, if a friend does that, it's quite sad because it shows that they didn't actually care about you, which is, you know, a bit sad. And maybe it's just me, but I'm sure that there are other patients out there who have such nightmares and therefore they'll feel the same way as I do about how their friends approach them in terms of, you know, asking for photos, whether it's, you know, trying to be friendly or be funny or purely just curious. They might not see it as a gesture of concern, but more of a gesture of mockery, potential gesture of mockery if the tone is wrong. So friends might want to take note of that bit. And yeah, that's just a side note to me. Which I really think the way I thought was completely legit. And I can still tell, and to me, okay, fine. If you don't think that it makes sense for me to tell you not to circulate my photos, well, I could just be really blunt and say, I don't owe anyone an explanation, and if I were to send you my photos, it's my prerogative to, on whether or not, firstly, on whether or not I want to send you, and secondly, whether or not I hope that you don't or do circulate the photos, because it's mine. So if I were to be harsh, I could have said that, but I realised that there is actually a very deeply rooted feeling inside me that's causing me to tell people not to circulate them. And I think as friends, people should understand. If not, then, well, if not, then your friends aren't very nice people, or, you know, just not very good friends of yours. So yeah, bye.